Hi guys, this is Sofia Reyes and I will be presenting to you my case report.
Mr. Addison, age 84, has a urinary tract infection and is prescribed sulfodoximvantin 100 mg tablets that he must take every 12 hours for 7 days. Discuss suggestions you could give to this patient to help him remember to take his medicine as prescribed.
But first, let us define what is urinary tract infection, or the so-called UTI. Infection occurs mainly in different urinary organs, namely the kidney, the ureter, the bladder, and the urethra. Our urine is normally sterile, but when the bacteria get into the urine and begin to grow, infection occurs. E. coli move from the area around the anus to the opening of the urethra. The farther up in the urinary tract the infection is located, the more serious it is. So what are the causes and risk factors? Since our patient Mr. Addison is an elderly, he might be catheterized for long periods of time and is immunocompromised, thus vulnerable to the said infection. Addition to that is the improper wiping and sexual intercourse and less water intake, and lastly, poor hygiene. Cefpodoxime-vantin is an oral prescription antibiotic drug and is included in the third-generation cephalosporins family of antibiotics. Urinary tract infections are treated with 100 mg per 12 hours for 7 days and is taken through oral administration. Here are my suggestions. So, sir, good morning po. Yung cefpodoxime na gamot na iinumin niyo po, usually, tinitake po siya every 12 hours. So, pwede pong 8 a.m. Then, yung second dose po is sa 8 p.m. naman po. So, kapag wala naman po kayong kasama, pwede niyo po siya isabay sa pagkain niyo ng umagahan or pagkain niyo ng hapunan. So, pwede rin po niyong ilagay sa ziplock yung first and second dose na iinumin niyo po para hindi po kayo malito kung ano po yung medications na kailangan niyo pong i-take ng time na yun. So, mas maganda pag may kasamang relative yung patient. Why? Because since si Mr. Addison, he is already an elderly, mas oriented sa time yung relative niya na magpapaalala kay Mr. Addison to take his medicine. Bali yung prescription po ni Doktor, cefpodoxime po, no? Every 12 hours po, bali 2 times a day po, for 7 days. So yun po. Tablet po siya, 100 ml.
Pwede rin tayong gumamit ng alarm to remind us from time to time.
Take note of this. So sir, kailangan lang po continuous tayo sa pag-inom ng gamot until sa prescription po ni doctor, which is 7 days. So once po na tinigil natin yung gamot, mas hindi po makikita yung results and improvements, and mas magiging resistant po yung bacteria sa ating urinary tract, and mas magiging malubha po yung infection natin. Tataas yung dosage na kailangan ng patient once na nangyari yon, and magkakaroon ng adverse effect. So, if nakalimutan nyo po yung isang dose, take nyo po yung dose na yon as soon as maalala nyo. Pero once na malapit na po yung time na pag-take nyo ng second dose, skip nyo na po yung first dose and proceed na po ulit kayo sa regular intake nyo ng medicine. And it's for today. I hope you guys learned something from me, and till my next video. Bye!